Thank you all for attending this health awareness event. This is a one in a series of events that we've held since the beginning of the year. So we're glad you're here. This health awareness series is designed to guide your journey to better health and well-being. We've chosen topics that we think will interest you and help you to make healthy choices. When you have more information about your health, you have valuable knowledge that can help you manage your health conditions. We're glad you're here with us today. And if you're tuning in during a live event, please know that healthcare professionals will be available after the presentation to answer your questions. In the future, you can find a recording of this presentation on the Highmark Health Options website. If you wish to refer to this information or share it with someone, that is. And we're glad to share this information with you, but please note that it's not intended to be a substitute in any way for professional medical advice, diagnosis, or treatment. Please always seek the advice of your physician or other qualified health provider with any questions or concerns regarding a medical condition. Today, we're going to talk a little bit about two topics, the first of which being how to talk with your healthcare provider. And then the second topic is about physical activity and how to easily become more active. And with us today to share this important information is Jennifer Fenstermacher. I'll allow Jennifer to introduce herself. Thanks for being here today, Jennifer.
Thank you so much, Jack. I appreciate it. My name's Jennifer Fenstermacher. I am a care coordinator with the private duty nursing pod. I've been with Highmark Health Options almost 6 years, and I'm really looking forward to sharing this information with you today. So let's get started. Our topic today is how to talk with your healthcare provider. So it's important for you to understand your doctor and for your doctor to understand you, because it is a relationship and it is a key to improving your health so that you can have honest, open communication, which is essential when you're dealing with your medical issues. These are some of the topics that you might want to address with your doctor and get more information about. Your medications, what are you taking them for? What are the possible side effects? How long will you need to take them? Appointments. Do you have follow-up appointments that you need to attend to? Are they with different doctors or are they with your primary care physician? Informed consents. These are the forms that you have to review and sign when you're going to have a test or procedure done. And please make sure that if you don't speak English, that you get them in your native language to help you understand it better. Also, discharge instructions. These are the paperwork with instructions that the hospital or a testing facility will give to you to explain what happened during your stay and any aftercare that is necessary. Insurance applications and information. If you already have Highmark Health Options, please know that you can always contact member services with any questions that you might have. So how do we partner with your doctor? First, we need to tell the doctor what's bothering you so that he can answer any questions that he may have. You may not ever considered yourself as a partner with your doctor, but these are simple ways to partner with the doctor as you talk about your health. You and your doctor are a team with the goal of keeping you healthy and happy. And you can ask your doctor for any support in communication, speaking slower, speaking louder, asking for an interpreter, if that will help you better understand your medical care. Important takeaways. A patient-doctor relationship is meant to be a healthy partnership. If you don't understand your doctor, never be too embarrassed to ask questions. You're probably not the first person that has asked that question, and doctors have pretty much heard everything. When you think you understand, you can repeat the information and instructions back to your doctor to make sure. And remember, it's always okay to say, I don't understand. Can you please explain that again? So how do we prepare to talk with our doctor? So what's bothering you? Talking about your health means sharing information about how you feel. Sometimes it's hard to remember everything when you get to the doctor. Sometimes you're a little nervous. Sometimes maybe traffic was bad and you got there late. So it's really helpful to make a list of your symptoms before you go to the visit so that you don't forget to tell the doctor anything. Symptoms can be physical. They can be a pain, a fever, a lump or a bump, a change in your energy level, if you're having trouble sleeping or you're sleeping too much, or if you have unexplained weight loss or weight gain. Symptoms could also involve your thoughts and your feelings. You'll want to tell your doctor if you're having trouble thinking, if you're confused, if you feel sad a lot, if you're anxious. And oftentimes, a doctor is pretty busy and they may not have time to talk about all your symptoms. So when you make your list of what's bothering you, please put the most important ones at the top so you'll be able to deal with those first. Things your doctor's going to want to know from you. What are the symptoms? When did they start? How often do they happen? Is it all of the time? It is a certain time of day? Is it only when you're laying down? What makes it better? What makes it worse? Is it keeping you from doing the things you normally would do in your daily life? Has this ever happened to you before? If so, when did it happen and what helped make it better? These are also things that are helpful to write down before you go to visit your doctor. Section 3, questions to ask your doctor. So sometimes doctors want to do blood tests or x-rays, MRIs, or other tests to help find out what's wrong or to learn about your health problem. These are some questions you might want to ask before a test is done. What is the test going to tell me? What does it involve? Is there any preparation I need to do? And are there any dangers or side effects I need to consider? After you get your tests done, the doctor may be able to give you a diagnosis. This is what the doctor thinks your health problem is. And you're going to have questions. These are some examples of what those questions might be. How did I get this? What caused this condition? How long is it going to last? Is it going to be permanent? So what do I do to make it better? How do we treat it? And how is this going to affect me? There are important steps in a doctor-patient communication. One is sharing information, 2, receiving the information, and 3, making decisions together about your health care. You need to know your treatment choices. You need to know the risk and the benefits of each of those choices. And you should ask yourself, which treatment is best for me, given my values, my beliefs, and my circumstances? Support is really important. Sometimes you'll feel better if you have an extra person there with you that you trust, someone that you can rely on if the information maybe is too emotional. Consider taking along a family member or a friend when you visit the doctor that can act as your health advocate. Your health advocate can help if there are language or cultural differences between you and your doctor. If you feel unsure about the topic, maybe that other person can help you describe your feelings or ask questions that you may not think of. It also helps to have another person's perspective. And sometimes it's really helpful to have them take notes about what the doctor is saying for you to review later. They may also think of questions or raise concerns you didn't consider. And before you leave the appointment, make sure you know what follow-up is necessary and schedule any appointments.